Hello. Yeah, this material is for lecture week 3, first part of this lecture. Okay, you can download the paper. Its title is Future Smart Connected Communities to Fight COVID-19 Outbreak. Yeah. First author is Gupta. Yeah, Gupta is a very famous researcher in United States. Okay. Let's check abstract of this paper. Okay. He say Internet of Things has grown rapidly in last decade. Continue to develop in terms of dimension, size, complexity, offering a wide range of devices to support a diverse set of applications. With a ubiquitous internet, including human beings, Internet of Things. Connected sensors, actuators, networking communication technology, along with artificial intelligence, smart cyber physical systems provide service rendering assistance and convenience to human in daily lives. However, the recent outbreak of COVID-19 pandemic has highlighted the limitation of contemporary technological deployments, especially to contain widespread of this disease. Internet of Things and smart connected technologies, together with the data-driven applications, can play a crucial role not only in prevention, mitigation, or continuous remote monitoring of patient, but also enables prompt enforcement of guidelines, rules, administrative orders to contain such future outbreak. Here contain is restrict such future outbreak. In their paper, they envision IoT and data-supported connected system designed for intelligent monitoring, proactive prevention and control, mitigation of COVID-19 and similar epidemics. They provide applications and technology systems for various smart infrastructure, including e-health, smart home, supply chain management, transportation, smart city, which will work in convergence to develop pandemic-proof future smart communities. They also present a generalized cloud-enabled IoT implementation framework along with scientific solutions, which can be adapted and extended to deploy smart connected ecosystem scenarios using widely used Amazon Web Service cloud infrastructure, AWS. In addition, they also implement e-health RPM use case scenario to demonstrate the need of and practicability for smart connected communities. Okay. Let's move to introduction and motivation of this paper. COVID-19 is an infectious disease caused by coronavirus, SARS-CoV-2. Is rapidly spreading around the world. According to World Health Organization, COVID-19 has already affected 215 countries and territories around the world and continue to spread rapidly across other regions. The highly contagious coronavirus outbreak was declared a pandemic by March 11, 2020. World Health Organization reports number of positive cases has dramatically surged, with nearly 34.5 million reported cases and 1.03 million fatally died as of October 1, 2020. In order to control the spread of the pandemic, lockdown, quarantines, and stay-home orders have been issued by several nations across the world. It has crippled the national and the world economy with a critical consequence to workers, employers, investors. In addition, the industries, business, and travel restrictions restrain the supply of goods and services. the economic disruptions will continue to have a long-term impact on global supply chains and economy. In the United States, unemployment rate reached to 14.7% in April 2020. It's a highest level since the Great Depression. In addition to fear of a stronger second wave of the disease looming during fall season. Okay. Currently, with no cure vaccine for disease, we have a vaccine now, but this paper published last year, so they say no cure vaccines. The first line of defense to fight against this pandemic is combination of preventive measure and mitigation strategies. Mitigation strategy corresponds to limiting the number of the coronavirus positive impacted persons. As suggested by WHO and the U.S. Centers for Disease Control and Prevention, CDC, and several other federal organizations suggest social distancing, environmental surface cleaning, self-isolation, travel restrictions, local and national lockdown, quarantine, limits on large gatherings, restriction on opening business, school closures, as some of preventive measures that are needed to limit the spread of disease. This is kind of mitigation strategies. However, these guidelines impose restrictions which hinder the way of normal life for humans. It has become a big challenge to swiftly implement and enforce such measures on a large scale across cities, nations around the world. They believe no effectively enforce, monitor the preventive control and the mitigation strategies for COVID-19. IoT, together with its key enabling computing technologies, including cloud, AI, and data-driven applications, can play a pivotal role. its main role. Okay, let's see existing examples of the use of technology to control the spread of COVID-19. Solutions have been proposed to manage a large gathering of individuals to limit infected case. United States CDC has introduced a self-checker application enabled with the cloud platform, which helps a patient to make a decision to find the appropriate healthcare service through questionnaires. However, most people don't have any symptoms, who are known as silent spreaders or symptomatic carriers. Therefore, conducting large-scale testing for everyone is paramount to show the spread. The United States is conducting nearly 1 million tests every day as of October 1st, 2020, to early determine isolate patients, which helps in treatment. Taiwan leverages database from National Health Insurance and integrated it with its immigration and customs database to begin the creation of big data for analytic generated real-time alert during a critical visit based on travel history and clinical symptoms to add case identification. In April, New York City reported 13 positive cases of COVID-19. The fatality rate of this city is 11% as of May 10, and 0.5% of fatalities have been in nursing home. Nursing homes are the most vulnerable spot in terms of health risks. Technology can assist in enforcing the prevention measures and the mitigation strategies in nursing homes to flatten the curve of fatality rate. Some states, Iowa, Minnesota, Tennessee, and Texas, have partially reopened, and the models have predicted that the number of cases and the fatalities will increase as the country moves toward reopening business and cities. These pieces of evidence show that communities are not prepared to reopen, operate, and handle such pandemics. There are several requirements to assistant in tracking and monitoring COVID-19 patients, such as to enforce wearing mask in public area, proper sanitizing, social distancing, mass quarantine for mild symptom people, and the testing at a large scale. According to Harvard Global Health Institute, 31 states in the United States have insufficient testing levels, and 10 states would need at least 10,000 more tests a day to begin gradually opening. For instance, in April 2020, New York and the state with the largest number of cases needed to increase testing by more than 10,000 per day. Due to a lack of enough testing kits, an antibody test online is offered for those people who recently got sick and think they might have COVID-19. In today's world, not having network capability in device limit the market potential for that device. As a result, there are a large number of and various types of network connected IoT devices providing convenience, ease of life to humans. With new technological advance, this trend is expected to continue and grow in the future. IoT market is currently valued at $267 billion per year. Is expected to reach $520 billion by 2021. Another recent article predicted more than 100 billion devices to be interconnected by 2025. Okay, 100 billion devices. I think the world population is enough device. I don't know the world population. In the previous slide, it is shown that 100 billion devices will be interconnected to network by 2025. Let's see overview of covering smart connected ecosystem. Okay. Okay, e-health. First, e-health. You can imagine smart hospital, remote patient monitoring, smart testing booths, smart home, patient home isolation, smart sanitize, smart city, smart tracking, smart testing vehicles, smart locality, smart neighborhood, smart child care and smart nursing home. Smart supply chain management, smart inventory, smart grocery store, and smart testing booths.
Okay. IoT, Internet of Things, comprise a large number of novel consumer devices, such as HDMI sticks, IP cameras, smartwatches, connected light bulbs, smart thermostat, health and fitness trackers, smart locks, connected sprinkler systems, garage connectivity kits, window and door sensors, so you can measure the temperature, outside temperature. In the inside of the house using window sensors, smart light switch, home security systems, smart ovens, smart baby monitors, blood pressure monitors. All these devices are consumer device. However, mostly these consumer IoT devices are used in distributed manner based on users' requirement. This means each user has its own consumer device and deploy their consumer device for their own purpose. Yeah. IoT, including okay. IoT, including the smart sensors, actuators, and the device, and data-driven applications, can enable future smart connected communities to strengthen the health and economical postures of the nations to fight against the current coronavirus situation and other future pandemics epicentry. Yeah. These smart devices, smart sensors, actuators, and device data-driven applications, these smart devices have potential to be a major breakdown in efforts to control and fight against the current pandemic situation. Internet of Things is an emerging field of research along with the ubiquitous availability of smart technologies as well as increased risk of infectious disease spread through the globalization and the interconnection of the world necessitate its use for predicting, monitoring, tracking to prevent from COVID-19. In their paper, they present IoT-enabled smart communities. They present vision about the IoT-enabled smart communities utilizing various IoT device applications and the relevant technologies. For example, artificial intelligence, machine learning, blockchain. We already have seen figure 1. Figure 1 shows overview of a smart connected ecosystem with real-world scenarios in diverse application domain focusing on detection, prevention, mitigation of COVID-19 and similar outbreak. They summarized their contribution as follows for this paper. They present an extensive review of IoT along with the emerging technologies currently used to control the pandemic crisis. Okay, and they outline some of the COVID-19 symptoms, preventive measures, mitigation strategies, and current problems, and the challenges to understand the need of proposal the connected ecosystem. They also present the adaptive multi-layered IoT architecture supporting edge, virtual object, and the cloud layer, and reflect interaction between them to focus on data-driven and connected smart applications catering to limit the COVID-19 outbreak. They design a smart connected ecosystem by developing multiple multiple IoT application framework, including e-health, smart home, supply chain management, transportation, and smart city. Okay. They introduce the convergence of these domains and offer novel use of cases and application scenario for early COVID-19 detection, prevention, and mitigation. They also present a general implementation of this present framework that can be used for adapted and extended to enable smart communities use case scenarios utilizing a real-world cloud-enabled IoT platform. Amazon Web Service, AWS. They also design a specific algorithm which can be used in different scenarios as required. And they implement a RPM, remote patient monitoring use case within e-health domain, very relevant to COVID-19 patients in home isolation and enforcing quarantines. Okay, let's see the related work and the background study, relevant background study. The use of IoT along with the emerging technologies can play a significant role to deal with COVID-19. Okay. This work justified Internet of Things has influenced the healthcare and other areas of our life significantly. In current situation, hospital practitioners are working hard to help impacted patients, and we are living in a new normal with new rules, such as state leaders mandate rules to maintain 6 feet distance, wear masks in public place. Wide use of IoT technologies enable us to deal with COVID-19 or any future pandemic situation. For instance, Chinese government installed CCTV cameras at home or apartment door of those under a quarantine period to monitor the patient activity. Human activity also measured through a linear model based on state space method. Drones are used to notify people to wear their masks. And the digital barcodes on mobile application highlight the health status of individual. Researchers at the University of Michigan, together with the team at Voxel 51, have presented the physical distancing index to help track how COVID-19 news or events impact human activity around the globe in real time. Free AI-powered interactive tool enable users to explore a day-by-day timeline of social activity in some of the world's most populated areas to track social distancing. Currently, Voxel 51 gathers and analyzes historical and real-time video streams from public street cameras in Ann Arbor, Detroit, Times Square, Abbey Road in London, Fremont Street in downtown Las Vegas, Seaside Heights in New Jersey, a beach from Lauderdale in Prague. Table 1 summarized the prior research along with their challenges, contribution to prevent and mitigate COVID-19 using specific technologies such as IoT, machine learning, and the blockchain. In existing literature, various IoT-based solutions along with other technologies are proposed for smart healthcare. Various frameworks and systems are discussed in the context of healthcare for handling COVID-19. Here, critical analysis of current IoT-based research shows that most of them are focused on single-use care. However, we need a holistic smart echo comprising multiple entities and different stakeholders to handle current or similar future pandemic situations. Therefore, they present future smart connected communities to fight COVID-19 and appropriately handle future pandemic situation. Let's see the current research works, IoT-based solutions to mitigate COVID-19. Okay, I think this first one is Chinese expert consensus on Internet of Things, aided diagnosis and the treatment of COVID-19. This paper focused on enabling different level of COVID-19 diagnosis and treatment along with the different doctors from different hospitals through the intelligent assistance of the NC application system. Contribution related to develop the COVID-19 intelligent diagnosis treatment assistance program. Based on Internet of Things. Yeah. Design 15 easy-to-use questionnaires for intelligent processing. So limitation is the data based on questionnaires is filled manually. And the security and the privacy issues related to patient personal data has not been discussed. Okay. Next paper, artificial intelligence application for COVID-19 pandemic. This is a paper about the role of AI as a decisive technology to analyze and prepare us for prevention by COVID-19. Contribution identifies 7 significant AI-assisted applications for fight with COVID-19, detect the cluster of positive cases, and predict where this virus will affect in the future by collecting and analyzing previous data or previous data. Enable to predict where this virus will affect in the future. Okay, next paper, Industry 4.0 technologies and their application in fighting COVID-19 pandemic. Contribution, see, present 10 technologies: artificial intelligence, big data, Internet of Things, virtual reality, holography, cloud computing, autonomous robot, 3D scanning, 3D printing, and biosensor. Okay, the limitation is only medical concern have been discussed here. Okay. And next paper is the role of IoT to avoid the spreading COVID-19. Okay. Contribution, let's see, contribution only. Present IoT architecture to avoid COVID-19. Present the use of IoT with the smart sensors to measure and record the body temperature of individuals, which can help identify infected individuals. Okay. So the limitation is the number of sensors to develop a particular application are not limited. Okay. Okay. Next paper,
is the data science and the role of artificial intelligence in achieving fast diagnosis of COVID-19. Okay. This paper helps identify COVID-19 impacted people. Identify COVID-19 impacted people among the individuals by utilizing CT scan and chest X-ray images using AI. Okay. Utilizing CT scan and chest X-ray images using AI. Okay. So they use the AI technology and calculate the accuracy of an image using decision of tree classifier. Okay. Next paper is the paper of an IoT-based framework for early identification and monitoring of COVID-19 cases. So this is identification of potential cases of COVID-19. So they use 8 classification algorithm on real COVID-19's symptoms dataset using IoT framework to identify COVID-19. So the limitation of this paper is the generated data set can be biased. If number of COVID-19 cases are less than other type of disease, then the model can send a false alarm. Okay, paper, blockchain related paper, Internet of Things and the blockchain-based network for COVID-19 disease. This paper aims to assist impacted people online using Internet of Things and the blockchain technologies through smart device. Okay, develop IoT blockchain-based framework for healthcare. Okay, and the next paper is drone-based networked system and the method for combating coronavirus disease pandemic. This paper used drone, which is used to handle pandemic situations in real-world scenarios. So they collect data through drones. So develop multi-layered architecture that collect information from drones. So implement a real-time drone-based system for sanitization, monitoring, and other applications. Okay. Next paper is application of machine learning and artificial intelligence for
COVID-19. So this paper presents a review of AI and machine learning as one significant method in the area of screening, predicting, forecasting, contact tracing, and drug development for SARS-CoV-2 COVID-19 related pandemic. Okay. Next paper is Internet of Things application to fight against COVID-19 pandemics. It enables Internet of Things-based healthcare system, which help to increase patient satisfaction, reduce the readmission rate in hospital. Also, application of cognitive Internet of Medical Things for COVID-19 pandemic. Okay, this paper presents the cognitive Internet of Medical Things platform, which enables real-time tracking, remote health monitoring, and other applications to reduce workload on medical industry. Okay. But the limitation is no implementation details of any application discussed. Next paper is Restructured Society and the Environment to control COVID-19 pandemic. So this paper describes the various implemented technologies that assist the healthcare system, government, and the public in diverse aspects for fighting against COVID-19. So, limited technological solution for COVID-19 risks. No any novel idea not presented. Okay, there is paper, Emerging Technologies for use in study, diagnosis, and the treatment of patients with COVID-19. This paper focused on analyzing possible opportunities and the challenges interesting emerging technology in the COVID-19 contact tracing. This also is not clear how effective the current contact tracing application would be using emerging technologies. Okay. Last paper is role of biological data mining and machine learning techniques in detecting, diagnosing the novel COVID-19. This aims to address the limitation of utilizing data mining, ML machine learning algorithm to mitigate this virus. Okay. This paper reviews 8 articles, which shows data mining and the ML-based application. Okay, let's move to chapter 3 of this paper. Essential characteristics to diagnose, prevent, and mitigate COVID-19. Okay, COVID-19
virus moves mainly by impacted person's saliva and nasal drips. Drips, which spread during coughing and sneezing around anybody in close contact. Another source of infection is contaminated surface in surrounding and high-risk areas such as door handles, railings, elevators, and public restrooms. COVID-19 is a highly contagious virus with an incubation period stretched from 2 days and 2 weeks after exposure. Symptoms of COVID-19 range from mild symptoms including fever, coughing, shortness of breath, to severe symptoms including organ failure, such as kidney failure. Researchers are still studying the virus to fully understand the characteristics and the new symptoms of this disease. Recently, the US CDC added 6 new possible symptoms, including chills, muscle pain, headache, sore throat, loss of taste or smell, loss of smell. New York City reported 73 cases of children with the coronavirus inflammatory illness on May 7, 2020. At this time, any specific treatment is not recommended for disease caused by novel coronavirus, and no vaccine is currently available in the market. Now, this paper is 2020, published 2020. Now the vaccine is available anyway. The treatment is subjective and depends on a case-by-case basis, where oxygen therapy shows a positive effect as a treatment intervention for patients with severe infection. Mechanical ventilation may be necessary in case of respiratory failure refractory to oxygen therapy. The US CDC and other resource explains early signs and symptoms, some preventive measures, mitigation scenarios. On March 19, 2020, the WHO, World Health Organization,
released the first edition of interim guidance on infection prevention and control strategies for identifying the coronavirus infection. On May 28, 2020, U.S. Food and Drug Administration, FDA, provided the emergency use authorization for hydroxychloroquine medicine, anyway, to treat the people who are suffering from this virus in hospitals. Later, April 24, 2020, FDA warned against the use of hydroxychloroquine to treat this disease outside of the hospital setting or a clinical trial due to risk of heart rhythm problem. People can protect themselves by following some protective measures. Help to slow the spread using mitigation strategies. Table 2 provides a comprehensive overview of symptoms, preventive measures, mitigation strategies, and some challenges fighting COVID-19 disease. One of the easiest preventive measures is to wash your hands frequently, thoroughly, with soap and water for at least 20 seconds, or use hand sanitizer or alcohol-based hand rub, and soap and water are not available. People should keep social distancing, 6 feet distance from others, especially from people who are coughing or sneezing. It is suggested to wear mask and gloves in public setting. Avoid touching the faces and the surface, such as the button at the traffic light. Keypad to add a tip for restaurant takeout order. Elevator button, etc. Many surfaces are touched by hand accidentally, and virus can be potentially picked up and then transmitted to other surface and location. Once the hands are contaminated, the virus can be transported through eyes, nose, or mouth. Thus, it enters the human body. Respiratory cough etiquette is a term used to describe infection prevention measures to decrease the transmission of a virus. There is a need to avoid cough or sneeze into hands
and to cover mouth and nose with a tissue and throw away the tissue immediately. Grocery and the packet can be contaminated from coronavirus. It is recommended to wash grocery items carefully and wipe packet envelopes using disinfectant spray. Local public health administrations regularly issue health guidelines which people should follow. The World Health Organization, government, and healthcare workers are all urging people to stay home if they can. On top of basic illness prevention, experts said that the best defense against the disease is a strong immune system. In addition to physical health, taking care of mental health is also necessary. High stress levels can take a toll on humans' immune system, which is the opposite of what people want in this situation. In addition, mitigation strategies are a set of actions applied by the people and the communities, such as hospitals, grocery stores, and cities, to help slow the spread of respiratory virus infections. These actions can be scaled up or down depending on the evolving local situation. At an individual level, if a person is infected with the coronavirus, then he or she should self-isolate and follow the guideline of quarantine provided by hospital. Hospitals must support healthcare workforce, increasing testing and intensive care capacity and the availability of personal protective equipment. City government can appoint a task force, open shelters for homeless people, and maintain availability of resources to implement preventive and mitigation strategies for this disease. While can communities unique appropriate mitigation strategies vary based on the level of community transmission. Characteristics of the community and their populations, and the local capacity to implement strategies. Nonetheless, it is crucial to understand the characteristics of this novel virus, spread awareness and up-to-date information across communities through appropriate technologies. Consequently, it is essential to address the challenges with significant research and implement of strategies as shown in Table 2. Okay, let's see the table which state COVID-19 symptoms, prevention, Mitigation challenges. Okay, first, is early symptoms. For the symptom of a common symptom include fever, dry cough, this is fatigue. Okay, prevention measure. Clean hands often, at least 20 seconds with soap and water. Or use alcohol-based hand sanitizer. Okay. From the viewpoint of mitigation strategies, if a sick stays in single room for 14 days, avoid sharing personal household items. Okay, problem and challenges. It says anxiety disorder, depression, mental health problems. Next, next early symptoms. Shortage of breath. Cannot breathe deeply enough to fill your lungs with air. Chills. Preventive measure. Avoid face-to-face meetings. Practice social distance. Monitor symptoms regularly. Wear N95 mask over the nose and mouth. Knowledge gaps to understand the virus transmission and no specific antiviral treatment. Next symptom, loss of sense of smell. Most likely to occur by the third day of infection. Okay, preventive measure, cover mouth and nose with clothes. Wear masks. Hand around others. Wear gloves and discard them properly. Okay. Okay, this is prior to fever, sudden confusion or inability to wake up and be alert may be a serious sign. Preventive measures cover your mouth and nose with tissue when you cough and sneeze. Okay. And a small number of patients can have a headache. Okay. Or relatively symptomatic here is not is symptomatic. This is maintain proper hygienic and clean, disinfect frequently touched surface, wash grocery items properly. This is pneumonia. Okay, for this case, follow travel restrictions. Normal white blood cell count. Okay. Let's move to chapter 4, multi-layered smart community architecture. Okay. In this section, they show an integrated multi-layer IoT architecture which can fundamentally change the infrastructure and underlying technologies for smart community, including hospital, grocery retail store, transportation, and the city. Yeah, Figure 2 shows this multi-layer IoT architecture. Their proposed architecture extend and adapt existing IoT CPS architecture and their architecture focused on the need for safety enforcement of policies, laws, and public guidelines in order to curtail the widespread of such disease. The architecture integrated hybrid cloud and edge computing nodes. Okay. Integrated hybrid cloud and edge computing node together with the IoT and smart sense device to enable real-time and data-driven service and application needed in COVID-19 pandemic. Overall architecture consists of 6 layers. Object layer, edge layer, vital object layer, cloud layer, network communication, and application layer. The object layer is a rich set of IoT devices, including sensor, actuator, embedded device, roadside infrastructure, vehicles. This is object layer. These physical objects are spread across and implemented in smart communities, such as hospital, retail store, homes, parking IoTs. The edge layer provides local real-time computation. This is important, local real-time computation. Okay, especially local. Edge layer, local real-time computation. And analysis needed for smart resource-contained physical object. Okay, local analysis. This is local analysis needed for smart resource-constrained physical object. Okay. Okay, once more, this is important. Okay. Edge layer. Okay, edge layer. This is local real-time computation and local analysis needed for smart resource-constrained physical object. Okay. This layer incorporates edge gateways and cloud set. Edge gateway and cloud set, which can enable local computation at this layer, overcoming limited bandwidth latency requirement, and also impact usability of IoT applications. This multi-layer architecture has integrated the concept of virtual object, which are the digital delineation of physical IoT device. Virtual object shows the current state of corresponding physical object in digital space when they are connected, and can also store future state for those devices when they are offline. The cloud layer provides various services like remote storage, computation, big data analysis, and data-driven AI applications for a huge amount of information generated by billions of IoT devices connected to cloud. We define a computation layer, which comprises of edge layer, virtual object layer, and cloud layer. Computation, data analytic and processing service are performed at this computation layer. Network communication layer runs among different layers to establish interaction. It is responsible for connecting physical sensors, smart device, edge compute nodes, or cloud service with different technologies. It is also used to transmitting processing sensor data. Application layer delivers a specific service to end users through different IoT applications. Task scheduling algorithm can be applied on this layer to manage the resources in order to deliver the optional quality of service. In the multi-layered smart communities architecture, this application integrated a mobile phone edge computing, cloud computing, AI-based analytic, data-driven services. This architecture can incorporate the IoT application frameworks within different domains, is discussed section 5. And the different use case scenario can be mapped and implemented using relevant technologies associated with each layer of the architecture. So let's see figure 2. This is adaptable multi-layered smart communities architecture. There are physical layer, okay, edge layer, local computation, responsible for local computation, fog layer, cloud layer, cloud computing, and application layer. This is provide user service. So network and the communication layer interconnect these different layers. Okay. Okay, this is a general multi-layered smart architecture, communities architecture. Okay. Okay, now this is the end of this week's lecture. For the next week lecture, now I assign homeworks. Each of you read thoroughly the next part of this paper that describe a smart connected ecosystem by developing the multiple strategic IoT application framework. Okay. This ecosystem include to describe e-health, smart home, supply chain management, transportation, and the smart city. Okay, read these parts, and you must be attend the next week's lecture. Okay. Thank you.